Good morning, everyone. This is a really quick update because I'm busy and I have lots to do, but I wanted to let you know that I did the two chemo treatments, and after the last time when they messed up and gave me chemo when I should have never had it because my white blood cell count was too low, I decided to stop the chemo treatments, and so tomorrow will be 4 weeks since the last time I had chemo, and I'm done with it. I should have listened to my instincts from the beginning. I never thought that it was right for me, and so I did two, and uh, all the doubts and fears that I had before I started chemo have disappeared, and I feel very strongly that um, I don't know, that chemo's not the right way for me to go, and I just wanted to let you know that I feel great. I feel perfectly fine. I'm still sticking with my healthy lifestyle, and I'm talking still with my naturopathic doctor out of Boston or somewhere around there. We have phone consultations once a week, and I've met with a holistic doctor, family physician here in Saginaw. And so I'm trying to find someone that I can work with that has the same kind of philosophies that I do, that, drugs aren't the only way to try to combat chronic illness. It's more about lifestyle, and there's other non-toxic ways to treat chronic illness. That's what I believe anyway. So, it takes a lot of work. It's not like you can just go take a pill. Just for example, I have allergies, and so my eyes were all swollen and everything for a week or so, and watery. It was horrible. And I used to take the Flonase, where you just squirt it in your nose. It takes 2 seconds, and it managed it just fine. But of course, that's $90 a month for the drug, and my insurance doesn't cover that, and so I can't afford it. And also, I don't want to take those drugs anymore if I don't have to. So I got I don't know what you call it. It's where it's a little thing, and you pour the water into one side of your nose, and it goes up and it goes into all those little tubes and everything, and it comes out the other side, and it cleans out your whole sinus area. And since I started doing that, I haven't had any problems with my allergies. So just simple things like that. It takes a little bit of time. I do it once in the morning and once at night. It takes about 5 minutes each. So you're talking 10 minutes out of my day. But I'm saving $90 a month, and I don't have to take any drugs to do it. So that's the kind of lifestyle that I'm trying to lead. And also, when you look at all the stuff I did for my cancer, I have all these studies, a whole file full of studies that my mom and my sister gathered for me that I read. I've got Outsmart Your Cancer, which is an excellent book. So this is my takeaway for you today. If you have cancer or know someone who has cancer, here's some books that you might be interested in reading if you want to find out if there's any alternative ways to combat cancer. This is really good. I haven't read the whole thing. I just started, but alternative non-toxic treatments that work. This right here was the first book I read, and it's so good. I just absolutely love it. If you know anyone who has cancer, please get them this book. If you don't get them anything else, get them this book. Anti-Cancer, A New Way of Life, and it's about this doctor, a brain surgeon or neurosurgeon that got brain cancer. No, wait, I don't know, he's some kind of doctor. He got brain cancer, and it tells his story, so it's a good read, but it also talks about American diet, and he gives you an anti-cancer diet, a whole section in here about what kind of foods you should eat and things like that. So, and then the last one I read, or no, this isn't the last one. I read this book, Questioning Chemotherapy by Ralph Moss. I got this, and that was really interesting. And then finally I got this, it's like 300 pages. It's called The Moss Report. It's also by the same author, Ralph Moss. And you can get it based on the type of cancer that you have. It's pretty expensive, but he talks about alternative treatments, or is chemotherapy effective for your type of cancer, what he found, and then what kind of alternative or non-toxic treatments have been shown to provide a benefit for specific types of cancers. And he used to work at the Sloan Kettering Hospital or Cancer Research Center, whatever it is, as a as a journalist, a scientific journalist, and he seems like a really smart guy. He spent his whole life researching and reporting on cancer and cancer treatment. So I feel like he knows what he's talking about. So that's what I would recommend for everybody. If you know someone who has cancer, some good books to read. I'll follow up, but I don't know when I'll do this again. The only thing I have left to do is figure out what to do about this boob situation. But as I mentioned before, I'll probably wait till fall to handle that. I'm going to go meet with Dr. Barry in May just to talk to him and see what my options are. And I'm really leery now about cutting any more than is necessary. Originally, I was like, oh, yeah, I get some new boobs. I'm going to get them bigger and all this kind of stuff. And now I'm like, well, I really want to minimize any more trauma to my body. So I don't know how I'm going to handle it yet. But I'm young and I'm almost single. I just got my divorce papers that I have to sign, and then I'll be single. So yay. Okay, well, that's it. And have a good day. We'll see ya.